Hey there. Today we're going to talk about proper hand washing. I know that's something that a lot of people kind of go, oh, I know how to wash my hands. I'm an adult. But you would be really surprised at how we don't always know how to properly wash our hands. So we're going to go ahead and go through that today. As you see on my screen, we're talking about proper hand washing primarily to help to prevent healthcare associated infections. Okay. And let's talk about what healthcare associated infections actually are. They are infections that patients can acquire while receiving treatment for medical or surgical conditions in a healthcare setting. So, patients that go into the hospital for long-term care, patients that even come into our clinics or our doctor's offices just for short-term care for a doctor's appointment can potentially acquire these infections because they came to see us. And these are infections that weren't present at the time the patient entered the facility or was admitted, say, into a hospital. They can develop during care. They can develop after discharge sometimes or after the patient goes home. So these are oftentimes associated with medical devices, any of the tools or equipment that we use in the office that weren't cleaned properly. Surgical procedures, and this can even include minor surgical procedures like we do in clinics and doctors' offices, or just transmission between the healthcare workers, us, and the patients. So that's why it's so very important to make sure that we are using proper standards of care and proper disinfection and sanitization and sterilization in our day-to-day practice. One thing that we always need to understand, and I've done this in a previous video, but one thing that's so very important to understand, even though we're just talking about proper hand washing today, is what the chain of infection is and how it works. So just to briefly refresh on the chain of infection, you have here starting out whatever the infectious agent is. Okay. And the infectious agent is anything, microorganism usually, that can cause infection. Okay. That can be bacteria or fungus or a parasite, anything, virus, okay? Anything that causes disease or infection or illness in the patient is called an infectious agent, okay? And obviously that has to be present in order for an infection to occur, okay? Next, we have the reservoir, or what we often refer to as a reservoir host, okay? And a reservoir host can be people, animals, can be in our water or our food. Okay. It's just a place where the infectious agent can reside and grow and reproduce and live. Okay. If the environment is such that a bacteria, say, or a fungus, or even a virus can't survive, then that is not a reservoir host. They have to be able to survive there. So once the reservoir host is housing the infectious agent, there then has to be a way for that infectious agent to escape or exit that host in order for the chain to continue. That can be through blood, excretions, through the skin, any way that that infectious agent can escape that host for that chain to continue. Now, if there's no way for it to get out, the chain ends. Okay. But if there is some way, so like if a patient is not secreting fluid or bleeding or anything like that, then chances are that agent is not going to leave the body. But if the patient, say, coughs or sneezes and the infectious agent is such that it can be carried through the air or through droplets, that's a means of exit, which then leads to the next link in the chain, so to speak, which is the mode of transmission. How is it being transmitted from that portal of exit from the reservoir host to possibly the next host? Okay. And that can be either physical contact directly, um, through droplets, like I mentioned, airborne. It could be foodborne, and directly ingested. There's many modes of transmission. And depending on what infectious agent we're talking about and how it is escaping, so to speak, or exiting the reservoir host, the mode of transmission really, really matters. Again, if there is no mode of transmission, though, the chain ends. It's broken. Okay. Next, we have the portal of entry. So, in order for this chain again to continue, now there has to be a portal of entry into another person or an animal, possibly. Um, that doesn't happen as often, though. So this can be through a mucous membrane, anything that lines like the inside of our nose. Through the respiratory tract, we breathe it in. The digestive system, we actually ingest the infectious agent, possibly through broken skin. If we have a cut on our hand and the infectious agent is to enter that cut, it can then get into our skin, our bloodstream, things like that. So there has to be a portal of entry. Again, if there's no portal, the chain is broken. Next, the host then that is providing that portal of entry has to be a susceptible host. Susceptible meaning they are susceptible or having traits that would allow them to take in that infectious agent and allow it to cause disease or illness in them. So that can be immune deficiency. Maybe they're run down. Maybe they have some type of comorbidity that is causing them to have an immune deficiency. Maybe they have diabetes. Diabetes, as we know, um, can or diabetics rather, can be very susceptible to infection because they don't heal as quickly. A burn right after surgery, okay? Possibly their age can make them susceptible. We know in speaking of, the immune system, the people that are most susceptible due to their age are the very, very young or the very, very old, right? Children, infants especially, haven't had time to build those immunities, haven't gotten the required vaccines yet, things like that. And then the elderly, their immune systems are starting to wane because of their age. So either way, that can be a factor in susceptibility as well. So again, and then we're right back to the infectious agent. So the biggest reason that we need to understand this chain is that anywhere this chain is broken is what can then disallow, so to speak, that infectious agent from creating illness or creating those HAIs, as we spoke of. Okay. So there's many steps we can take to break this chain. PPE is one of them. Personal protective equipment. Just wearing gloves sometimes can help. We know that would be true when we're talking about broken skin, right? If you have a cut on your hand and you have a bandage over it and you're wearing gloves, that portal of entry is done. There's nothing that's going to get in there. Okay. The modes of transmission and the portals of exit working together. If we cover our mouths as we should properly when we cough, it is less likely that that infectious agent can be transmitted. Okay. So there's plenty of things we can do, especially as healthcare workers, to make sure that this chain becomes broken. And hand washing, proper hand washing, is one of those. So when we talk about hand hygiene, we talk about it really being the first line of infection prevention. You hear people say, just wash your hands. It's true. Okay. When should we do that as healthcare workers? Well, when hands are either visibly dirty, contaminated with anything like blood or body fluids or anything like that, or whenever possible. Okay. And when I say whenever possible, I mean over the use of hand sanitizer. A lot of healthcare workers have gotten into this, I don't know, cycle of just, oh, we'll just hand sanitize. It's right there on the wall. We'll just, you know, hand sanitize in, hand sanitize out kind of thing. Really, and although, hand sanitizer, and we'll talk about that here in a second, hand sanitizer works. It's really better to wash your hands if you can. Okay, there's times we can't, and I understand that. But the steps in proper hand washing are to wet your hands with clean running water, either warm or cold. Usually warm is better. Apply soap and lather very well, covering all the surfaces of the palms of your hands, the backs of your hands, between your fingers, under your nails. You want to scrub or rub at least for 20 seconds. And we've all heard this, right? The sing the happy birthday song twice. Okay. Rinse very thoroughly under running water. Dry with a clean paper towel or an air dryer if you have access to that. And then use the paper towel that you've dried your hands off with to turn off the faucet, just so you're not recontaminating your hands. Um, if you have a setup where, you might, a lot of hospitals have where you can just push with your knee. There's a little lever that turns the water on, or even if they have the types of faucets that get turned on just by motion, you don't have to do that step. Otherwise, though, if you're going to touch anything after you've washed your hands, use the paper towel to do so. Now, as far as the use of alcohol-based hand sanitizer, you want to make sure that it is at least 70% alcohol if you're going to use this. When is it acceptable to use this? Well, when your hands aren't visibly dirty, or if soap and water is just not available. Sometimes it's not, and you just have to use a hand sanitizer. But you want to make sure you use it properly as well. And that is to apply a palm full of sanitizer into one hand, rub the hands together, covering all surfaces just like you would when you're washing your hands. Palms, back of the hands, in between the fingers. Continue rubbing until the hands become dry, which means the alcohol has either absorbed into the skin or it has evaporated. That's usually about 20 seconds as well, ironically. And then don't wipe or rinse anything before they're dry. This really reduces the effectiveness of the alcohol. Okay, so let's take a quick look at what proper hand washing actually looks like, and I will see you again soon. Take care.